Today we will learn TNM cancer staging for medical coders. So in live coding, most of the time we will see TNM classification, which we will use mostly for cancers. So here is the cheat sheet. Okay, so cancer staging made simple for coders. So the TNM system. So what is T here? T means tumor basically. So N means nodes. M means metastasis. So what is a tumor? So here tumor or T indicates the size of the primary tumor and how far it has grown into nearby tissue. Okay, so whenever we code malignant neoplasm, defaultly we will take primary. The documentation does not contain any secondary. So it is the primary neoplasm where the cancer starts. Okay, so which is T. Next we have N. So N means nodes. So it describes whether cancer has spread to nearby lymph nodes and how many are involved. Okay, so most of the time these nodes we will encounter in breast coding. So mostly 90% of the time, if the patient is having breast cancer, so that cancer will spread to lymph nodes too. Okay, so that time we will perform axillary lymphadenectomy. Okay, so this N encodes nodes. So here we will check whether patient has spread a cancer from primary organ to any lymph nodes. Okay, so next we have metastasis. So shows whether the cancer has spread to distant parts of the body. Okay, so T means tumor. So first place or primary location where tumor starts or cancer starts. So N means nodes. So here we need to check whether patient has spreading of primary cancer to any lymph nodes. For example, if it is breast, we need to check for axillary lymph nodes. Okay. If it is prostate, we need to check for pelvic lymph nodes. If it is uterine cancer, we need to check for other types of lymph nodes including pelvic. Okay. And M means metastasis. So here just basically here we need to check whether patient is having secondary cancer. So as always we know, so metastasis means if the patient is having cancer to another organ, we will call it as metastasis. Okay. For example, patient is having tumor or breast cancer and that cancer spreads to lung. Okay. So that time breast cancer becomes T and lung cancer become metastasis. Okay. So why means lung cancer is secondary, which is spread from breast cancer. So that is the good example for this TNM. And also whenever we see like live coding, we will see like numbering system. So T1, N0, M0 or T3, NM, M0. Okay, so what does that mean? So we will learn soon. In tumor section, we have three sections or three categories. Okay, so TX means primary tumor can't be evaluated. T0 means no evidence of a primary tumor. Okay, so T1 to T4 increasing numbers indicates a larger tumor or greater spread into nearby tissues. So subcategories such as T3A or T3B may be used for added detail based on the documentation. So here we will see here. So here we have T1. Okay, so what is here T1? So increasing numbers indicates large tumor or greater spread into near tissue. So here T1 means patient has cancer, but the cancer size is very less. For example, if we take T3 here, so here patient had grown cancer. So as this T1 to T4 indicates, so T1 means less size or smaller size tumor, T4 means larger size tumor. Simple, just like remember like that. So T1 means smaller size tumor, T4 means larger size tumor. Okay. Next we have classification or subcategory for lymph nodes. Usually in TNM classification, N means lymph nodes, correct? So most of the time these are regional lymph nodes. So regional lymph nodes means like axillary lymph nodes, pelvic lymph nodes, and other types of lymph nodes. Okay. So here regional lymph nodes N. NX means lymph nodes can't be evaluated. So here physician is unable to evaluate the lymph nodes. That time we will code NX. Next one is N0. No cancer found in nearby lymph nodes. So here patient does not have any cancer in the lymph nodes. So why this is important here? Most of the time, if the patient is having the cancer, primarily that cancer spreads into lymph nodes. Okay. So that is the reason most of the time if the patient is having the breast cancer, patient will perform first axillary lymphadenectomy. Okay. Next N1 to N3. So here also same. N1 means smaller lymph node cancer. N3 means like lymph node cancer is larger or more. Okay. So higher number indicate more lymph nodes involved or involvement further from the primary tumor. Okay. So basically in lymph nodes we have stations. So for example if we take N1, so means patient has cancer of only one lymph node. Okay. N2, like patient had cancer spread of 3 lymph nodes. For example, if you take N3, so patient had cancer of all lymph nodes. So that is the difference between these lymph nodes or these stages NX, N0 and N1 to N3. Next we have distant metastases. So in previous example, patient is having primary tumor or primary cancer in the breast and secondary cancer in the lung. Okay, so here M means metastasis. So distant metastasis. So MX means distant spread can't be evaluated. So here basically in TX, NX, MX, physician is unable to identify metastasis, lymph nodes or tumor during the biopsy. MO means no evidence of distant metastasis. M1 means cancer has spread to other parts of the body. Okay, so we will see this example here. T1, N0 and M0. Okay, just T1, N0, M0 indicates patient has primary tumor, but it is not spread into regional lymph nodes as well as there is no metastasis to other organs. Okay, now we will see T3, N1, M0. Okay, so here also patient had cancer and also patient has having lymph node cancer also. Here N1 means so spread. So N1 means like based on the number. So few lymph nodes are affected by cancer. So M0 means no evidence of distant metastasis. So that is the use of this TNM classification. And now we will see grouped cancer stages. So basically we have total 5 stages including stage 0. Okay. So stage 0 means abnormal cells are present but have not spread. This is called carcinoma in situ. Okay. CIS is not cancer but may become cancer. So most of the time we will see it as DCIS in breast. Okay. So DCIS means ductal carcinoma in situ. So DCIS consists of stage 0. So where patient had abnormal cells but they did not spread into lymph nodes or distant metastases. So basically DCIS is not a tumor but it is having the capability to become a tumor or cancer. Stage 1 to 3. So cancer is present here. So higher stages indicate larger tumor size or greater spread into nearby tissues or lymph nodes. Okay. So stage 4 is more severe than stage 1 to 3. So cancer has spread to distant organs or parts of the body. So these are the cancer stages. Okay. So the key tip here is higher stage numbers reflect more advanced disease. Okay. So letters may be added for further detail. such as stage 2A, stage 2B or 2C. Okay. And also we have few more common staging description for cancers. Okay. So most of the time in the documentation you will see in live coding in situ. So abnormal cells are present but have not spread. Okay. So we have discussed correct DCIS. So DCIS is ductal carcinoma in situ. Here patient had abnormal cells but they have not spread to lymph nodes or any other organ. So localized cancer. So cancer is confined to the area where it is started. So basically localized is primary cancer. Okay. So regional. Cancer has spread to nearby lymph nodes, tissues or organs. Okay. So basically this is secondary. So localized means primary, regional means secondary. Distance. Cancer has spread to the distant parts of the body. So in the previous example, patient had cancer in the breast, now it spreads to lung. So lung became distant cancer. So unknown. There is not enough information to determine the stage of the cancer. So these are the two types of stages related to breast cancer or any other types of cancer. And also if anyone looking for medical coding jobs in UAE, USA and India, please join in WhatsApp group. Group link is the description of this video. And also if anyone looking for same day surgery training, IPDRG training, SEC training, CCA certification training, please send WhatsApp message to 707-526-3939. And here we will see one real world example. So a 36-year-old female presents with breast cancer on the right breast, upper outer quadrant, staged as T2NM or T2N1M0. She is currently being treated with radiation therapy and hormone therapy, tamoxifen. So pathology report confirms positive axillary lymphadenopathy. Okay, so basically here patient had breast cancer as well as lymph node cancer. So here breast cancer become primary. So C50.411, malignant neoplasm of upper outer quadrant of the right female breast, primary cancer. So from the breast cancer which spreads to lymph nodes as patient is having positive axillary lymphadenopathy. So for lymph nodes you need to code C77.3, secondary and unspecified malignant neoplasm of axilla and upper lymph nodes, which will become secondary cancer. Here if you observe this one, T2 means, so what is T2 here? So we have the guideline here. So T2 means patient had cancer. T1 to T4 means patient had cancer. So tumor size is less compared to T4. Okay. So next one we have N1. So what is the N1 here? Here also same. Patient has spread of cancer to lymph nodes. So this is the N1 to N3. Okay. Next M0. So M0 means patient had cancer of breast as well as the lymph node. So there is no distant metastasis. So that's why they have mentioned M0 here. So if you observe this one, M0 means no evidence of distant metastasis. Okay. So like this we need to understand TNM staging while coding the live charts. Okay. So thank you guys. Thanks for watching this video. So if you have any doubt, please mention the comment section of this video. And again, if anyone looking for medical coding jobs in UAE, USA and EIA, please join in our WhatsApp group. Group link in the description of this video. Thank you.